Can't believe here I am on a Saturday night because it's raining here in Florida, and I'm doing part 5 of our series on supplement use during cancer treatment. This one dealing with vitamin C. A lot of people say they've been waiting for this one. And let me just first of all clarify that what we're talking about here today is buffered, B-U-F-F-E-R-E-D, buffered vitamin C, also known as calcium ascorbate, not ascorbic acid. Let's make that very clear. There's a distinction and a lot of research work that's been done about that. So we're going to talk about this, and once again, anything you hear today, take it to heart, make a decision on it, talk to your healthcare provider about it, then make the change. Don't attempt to do something on your own. We'll get started here in a minute. The information you hear on Health Talk with Dr. Len is intended to be strictly educational and is not intended to diagnose or treat any disease. Any medical decision should be made between you and your healthcare professional. And now, here is Dr. Len. It's amazing that we're going to be quoting from Time Magazine, an interesting piece of information that was published there not that long ago, talking to us about how vitamin C may help cancer treatments work better. How can they make it work better? We'll get involved in this, start in 1 minute. If you want to read this article yourself, you can go to time.me.com/4718630. 4718630. Cancer treatments are often hard on patients, but the side effects and challenges are necessary to control or even destroy tumor cells. Now researchers say there may be a way to make those treatments work even better. Listen up, oncologists. In a study published in the Journal of Cancer Cell, scientists say that giving people high doses of vitamin C during treatment may weaken cancer cells and make them more vulnerable to the effects of chemotherapy and radiation. In the study, which was designed to determine if vitamin C in high doses was safe, 11 people with aggressive brain cancer called glioblastoma, one of the most difficult to treat, were treated with vitamin C intravenously 3 times a week for 2 months. The dose was increased gradually while people underwent radiation therapy to ensure that enough vitamin C remained in the blood. The people in the trial reported no additional side effects or adverse symptoms associated with taking the high-dose vitamin C. Only those associated with normal chemotherapy and radiation treatment. The study was not structured to look at how effective vitamin C was, but the researchers note that so far, half the people in the study were alive nearly 2 years later. The average survival for the disease is generally no more than a year. In a separate study designed to get an early sense of the vitamin's effectiveness, the researchers also tested the high-dose vitamin C in a group of 14 people with non-small cell lung cancer. So far, 93% of the people receiving the vitamin C infusions are responding to chemo and radiation, compared to 40% that normally do. That's twice as many. In an encouraging finding, more than 30% of the people getting the vitamin C also showed signs that their tumors were shrinking. Dr. Douglas Spitz and Dr. Brian Allen, both in the Department of Radiation Oncology, University of Iowa, believe that it can also promote oxidative damage, but only in cancer cells. Hallelujah. Tumors seem to have higher levels of oxidative stress, which can produce free radicals. This promotes the release of unstable forms of iron, which react with the vitamin C and cause further damage to the cancer cell. The exciting part, says Allen, is that the unstable iron particles are unique to cancer cells. That makes them ideal targets for the vitamin C, which then may react with them to cause more damage and destroy the cell. The hope is that pairing large doses of vitamin C with chemotherapy and radiation can destroy cancer cells. Can destroy cancer cells. Now, keep in mind, all these studies are talking about intravenous, which is available in a lot of different areas now. First of all, it's going to be very difficult, if not impossible, to find an oncologist outside of maybe Cancer Treatment Centers of America that are aware of this kind of information and are open to using it. I still say it can easily be done and can be done effectively using buffered vitamin C in a powdered or oral form that we dose milligram per kilogram. It's important to note that doses used in these studies aren't achievable with supplements or massive amounts of orange juice. So they say, but with the newer forms of powdered buffered ascorbate, we can go as high as we need to. It's order of magnitude greater than the dose in a multivitamin, about 800 to 1,000-fold. Using vitamin C in cancer treatment was last championed by Nobel laureate Linus Pauling. He likely had the right idea, Spitz and Allen said, but it wasn't able to use high enough doses to see an effect. They are planning to continue their work with other cancers to see if the same weakness is common with other types of tumors. What do you think? Now I want you to listen to this. This is talking to us about buffered vitamin C. Hey everybody, I want to talk to you for just a minute about our most popular product called buffered vitamin C. It has a myriad of biological functions. Vitamin C helps toward collagen formation for many body tissues, including skin, gums, teeth, cartilage around joints. It enhances the absorption of iron in the body and so involved in energy metabolism and contributes to reduction of tiredness and fatigue. Vitamin C is the required coenzyme for two groups of enzymes that catalyze the cross-linking of collagen fibers. Vitamin C is essential for normal wound healing, capillary health. Also participates in the biosynthesis of carnitine, serotonin, that key neurotransmitter, and certain other neurotransmitters, including norepinephrine. Vitamin C, our buffered forms, water-soluble, chain-breaking antioxidant that reacts directly with superoxide, hydroxy radicals, and singlet oxygen. Vitamin C interacts with glutathione and alpha-lipoic acid and regenerates vitamin E. Now, our prep also has bioflavonoids in there called flavonoids, a class of phytochemicals that are potent antioxidants as well, which scavenge many potentially damaging free radicals. This well-designed product can allow a large dose of ingredients to be taken in a single serving. The organic food acid combines with the carbonate source to form potassium, sodium, calcium, and magnesium salts of the acid and buffers the solution to a normal pH, so it's easy on the stomach. Clinical studies performed on a variety of these types of products demonstrate that the ingredients, listen to this, penetrate the bloodstream within as little as 15 minutes. Buffered forms of vitamin C. I've said it over and over again. If I was stranded on a desert island and I couldn't take anything else with me, I'd have my buffered forms of vitamin C. You can find that on our website at thenutritionshop.net or call our office at 678-228-8900. That's 678-228-8900. Take care. And of course, as you probably know by now, the website has changed. It's a different address now, www.nutra, N-U-T-R-I, farm, P-H-A-R-M, LLC.com. On Monday's show, part 6 in the series, we're going to talk about the best anti-cancer supplements that are out there. We're going to go the simplistic route. So make sure you tune in on Monday. Pick it up wherever you're listening to this, either at that website, on Spreaker, all over the place. Just start searching around and you will find it. God bless you, folks. Have a great weekend, and we'll see you back here Monday. Take care.